Carl Humphreys. Thank you for coming by today.
Appreciate you inviting me.
Yeah, it's exciting. You know, we're on the McLeod board together.
That's right.
Which is so cool to me. I always thought it was cool that you're on that and how closely y'all work together. And it's a good dynamic.
I think it is. And Ed Beeling, our chief medical officer, Dr. Beeling, serves on the MUSC board. So I'm on the McLeod board. He's on the MUSC board. And we value those relationships. We can't do what we do as a community health center without the help of the hospitals. When it's time for our patients to be hospitalized, or if they need a certain type of specialty care, that's where those relationships become very critical. Yeah. And we can't do what we do without them.
A lot of people probably think y'all compete. No, you work together.
No, we do. It's both, right? So we're competitors, and we acknowledge that in some areas, right?
Right.
So when I need a primary care provider and I'm looking to hire Dr. Smith, they may be trying to hire Dr. Smith as well. And so we're fighting over Dr. Smith. So in that way, we compete. We compete after nurses. We compete for front desk workers. But that's friendly competition, right? And that's both of us trying to get a workforce that can help in the community. We compete in some business lines. So we do primary care. Both of the hospitals provide primary care.
Right.
We have pediatrics. McLeod has pediatrics. So there's competition there, but we acknowledge that competition. We acknowledge where we're competing with one another, but we acknowledge also that we're in it together, right? We're both trying to serve the community. We're both trying to make health outcomes better for Florence and for the surrounding areas throughout the Pee Dee. And so from that respect, we're much more cooperative and in spirit than we are competitors.
So, Carl, you're the CEO of Hope Health.
Yes.
And you just touched on something that I wanted us to get into. I didn't know that we'd start with it, but you talked about hiring quality healthcare workers. How hard is that as the CEO of Hope Health to get quality healthcare, physicians all the way down to nurses' aides?
It's a challenge. I was having breakfast with a community leader probably about a week ago. I think I ran into one of y'all when I was talking to this guy.
Yeah. I met you at Eggs Up, or saw you at Eggs Up.
Yeah, that's right. Yeah, Chipper Smith, city councilman. He said, I would try to get his quote right. It's easy to hire people to work. It's not easy to hire people that care.
Oh, yeah.
And I left that breakfast. I was thinking about that, and I was like, I've been using that. I've been talking about it for the last week or so. There are folks out there who will work, but we want to find people who care, right? And so there's a difference between an employee who will come, meet the bare minimum of what's needed to check the boxes, but in healthcare, that's not what we're looking for, and I think McLeod would say the same thing. We're looking for folks who will go the extra mile and who will do the things that are needed to really meet the needs of the patient. And so from a workforce standpoint, there are folks out there, but we want the best. We want folks who really care. Another way to look at it is, and you could kind of think about this from a real estate perspective too. Whenever you're working and you're doing what you do, are you completing a task, and are you concerned about the task, or are you concerned about the person behind the task?
Wow.
Right?
Yeah.
That's right.
So you can check boxes from a real estate perspective and say, well, I did this and I did that, but I know how the two of you guys operate. You're concerned about the person behind the task. You want to find out, well, what makes this person tick? What are their needs? And how can I meet the needs of the person rather than just going through the motions? Because I can still get my job done going through the motions, right?
Yeah.
So at Hope Health, we're looking for people who are interested in the person behind the task.
Wow.
And that's not always easy to find, but we got a lot of great people who see that.
And I'm sure part of your recruiting effort is casting that vision, telling that story, and hopefully those individuals. And I wonder if there's some of, I've talked to people about the generational differences between boomers and the younger generations, and maybe some of the younger generation is more interested in working for a cause.
Yeah.
And that's part of what you're sharing. And it's also a natural fit for healthcare because it's a service industry.
I think you're right, Reeves. I feel like and I don't know if you guys would agree with this or not. Maybe you've seen it and haven't. In the last decade, we've done a good bit of youth bashing, right?
Yeah.
Yes.
We say that the youth don't work as hard as we do, and they don't get it, and they're not
on
willing
their phones. They
yeah,
can't-
yeah. And I think we overdo that because I've seen what you see. I see a lot of young folks coming into the workplace these days who are looking for connectivity. They're looking for something that feeds their passion. They're looking for something that meets, you could call it an emotional need. Maybe it's a spiritual connection, whatever, that goes beyond just, clocking in to get a paycheck. And so I'm optimistic about that, and I see a good bit of that in the younger generation.
That's good. All right, well, let's back up a minute.
Yeah.
So you're the CEO of Hope Health.
Yeah.
Kind of take us through your personal career story and kind of how you got to this point.
Man,
'Cause
how much
I
time
think
you
it's
got?
interesting.
We want to go all the way back to TobyMac.
Yeah.
The days of you and
so
TobyMac.
start with that story. Tell us about
Yeah.
Toby.
Well, so I'll try to keep it succinct. I went to Bethlehem Baptist Christian Academy. When I showed up there in the 9th grade, I immediately met these two girls with the last name McKeon, Carrie and Kristen. One was in my class, a 9th grader, and one was a year ahead of me, 10th grade. Well, these were Toby's sisters.
Oh, wow.
Toby had already graduated,
Okay.
so I didn't know him, but I heard about him. He was kind of a legend in the school, real popular guy. Everybody thought was cool and all that. And this was a mostly white, suburban, private school, and there weren't a lot of people listening to rap music back then.
Yeah.
Well, I happened to be one of them. I picked up rap music in Germany when my dad when Dad was stationed there. I lived on a military base, and I just loved it from the moment I heard it. And so right away there was this connection because Toby liked rap, and he was one of the few people in that environment. And so when I would start talking about rap music or maybe trying to rap a little bit, people would be like, "Oh, that's little Toby right there. That's little Toby."
Yeah.
And I was like, "What are they talking about? I don't even know who they're talking about." And eventually, through his sisters and through his family, I was like a surrogate child. I was always over at the McKeon house, and it was kind of a place to hang out. And really loved his parents. And over time, I got to meet Toby and got to know him. And then in college, we didn't go to the same college. I came here to USC, but we just became friends because of rap music. And he would send me songs and say, "What do you think about this song?" And I'm like, "You're asking me? You know what I think about this song?" And so we just maintained that relationship. Now, I wouldn't say we're close friends, but we're friends.
But y'all still talk
and we
sometimes?
talk and we
Yeah.
text and play golf together, whenever we can. And, you guys know he was here in Florence last month and had the opportunity to go down and play golf together.
Oh, that's awesome.
Broom's Edge, which is a very
yeah.
I played it.
here.
Yeah.
Yeah. So that's it in a nutshell. And
Where does
that's-
he live now?
Yeah, so he's in Nashville.
He's in
Yeah,
Nashville.
Yeah, been in Nashville really going all the way back to the days of DC Talk.
Yeah.
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 All right, and so you mentioned you're a Gamecock.
Yep.
And we'll come back to that
Yeah.
maybe later.
Oh,
Yeah, it's
Lord.
important.
Oh,
Yeah,
Lord.
it's very important. But take us from being a Gamecock and going to college. And
Yeah.
We just lost half our views.
Yeah. Well, yeah, I mean,
well, we didn't need those. Hats.
well, maybe we'll get some of them back by telling people I was a Clemson fan as a child. So my mom's side of the family was Clemson. My dad, Gamecock. So I grew up as a Clemson fan. My dad says that when he was serving the country in Vietnam, my mom's brothers, my uncles, brainwashed me
Oh, okay.
as a small child. Brainwashed me into being Clemson. But we corrected that later. When it was time for me to go to college, Dad said I wanted to go to Liberty where all my friends were going. Mom and Dad were leaving for Korea, and their roots are here. They wanted me to be in South Carolina near my aunts and uncles and my grandmother. So they said, well, my dad said, you can go to college anywhere you want to go, but if you want me to pay for it, you'll go to the University of South Carolina.
There we go.
Yeah.
So that made that decision.
That's how I became a Gamecock, and never looked back because that's where I met my wife. She grew up, lived her whole life in Columbia. She was a student at Columbia College, which was an all-girls school there in Columbia, and we met waiting on tables, and so really my career started early in my marriage. We were waiting on tables. I was getting my master's degree in social work, and I have to try to tell this story succinctly because it has a lot of moving parts to it. but it's interesting the way God works in our lives,
Yes.
right? Because I wanted to work with children. I got my master's degree in social work, thought I wanted to do something with children. I went and applied for this job at the health department in Orangeburg to work with children. And the guy immediately started telling me about, oh, you don't want that job. He kind of pushing me this other direction. He said, well, it pays more and it requires experience, but I'm going to get a waiver for you, and you can and you can start Monday. He really hadn't even asked me the first interview question yet.
Wow.
And I said,
Like, you want to come to Orangeburg? Come on.
yeah. What I heard was pays more,
Yeah.
and I can start Monday.
Right, yeah.
Because Beth and I were paying the bills by waiting on tables, and I was ready to start my career, to have that professional job, right? So I show up, and I got one of these 1960s health department desks, and the nurse shows me my office. The guy who offered me the job, the head social work guy, is nowhere to be seen. So she takes me in my office, and she says, "Well, this would be your desk." And there's a big red HIV/AIDS manual on the desk. And I said, "Well, what's this HIV/AIDS manual?" She said, "Well, you're the new HIV/AIDS social worker."
Ooh.
I said, "I am?"
Okay.
It'll be great.
So Crawford, my boss, the social work boss, Crawford Dinkins, great guy, and he is a graduate of Claflin University and a career social worker. Still lives in Orangeburg. He didn't tell me, and I put the pieces of the puzzle together later. The position was vacant for 2 years. It required a master's degree in social work, which there weren't a lot of master's level social workers in Orangeburg.
Right.
We lived in Columbia, so I would drive to this job, and he was desperate to get that job filled, and so I think he was just trying to get me started and maybe hope that But here's what I'd say: it's like a peace almost immediately came over me. I'm looking at that manual, and I'm looking at this nurse, and I'm like, God has a plan, and I can't wait to see what He's going to do with this, And I always had a passion for people that nobody else really seemed to want to work with or that cared about, right? And so there was something about me that was immediately attracted to this idea of serving people who nobody else wanted to be around.
Yeah.
And so that's how my career started in HIV and AIDS. And I did that for 6 years. I worked for the health department. I got some leadership responsibilities. I got promoted in ways that were really unheard of for a social worker there, and God was just making all these things happen. And what ended up coming out of that is I became qualified through those 6 years to be the executive director of the HIV/AIDS organization here in Florence called Hope for the Pee Dee. And so that's how all this started, this HIV/AIDS organization. They hired me to be their executive director. We had 6 employees, and we had maybe 300 patients. And for the first 6-7 years I was here, that's what we did. We served HIV/AIDS patients. And a lot of people from Florence will remember that. We were called Hope for the Pee Dee.
So what years was this?
Yeah, early 2000s.
Okay.
Yeah, and then in 2007, we became a federally qualified health center. So that was an application that we had to put in federal government. And what that did, it completely changed our mission. So we went from being a narrow focus on only helping people living with HIV, to being a healthcare provider that could help anybody in the community, right? Through primary care, behavioral health, women's health services, and those types of things. So that adjusted our mission. We still have a huge commitment to the HIV/AIDS population. We serve more patients in the state of South Carolina living with HIV than any other entity other than MUSC and USC School of Medicine, which are 2 huge hospital systems.
Conglomerates.
Wow. So we're right behind them in terms of service to people living with HIV.
Is there still a lot of HIV?
Thankfully, we've done a lot to kind of alleviate new HIV/AIDS cases, but there are people testing positive all the time.
Wow.
I think the reason why you hear about it less is because the advancements in HIV.
It's treatable.
Yeah,
more
it's treatable. People look at it more as a chronic illness now. like hypertension or diabetes, rather than a terminal illness.
I remember when Magic Johnson, I remember the press conference.
That was a big deal.
Oh,
I mean, I still vividly remember the way his tie was tied, announcing to the world he had contracted HIV. I mean, and I was a young guy, and I remember thinking, this hero of mine, basketball player, is going to die. And
he was my favorite player.
Yeah, and he's still living with HIV.
So that's a microcosm of what we're talking about, right? And the treatments that are available to Magic Johnson, and obviously, in the early days, he would probably had access quicker and the best of all the providers. But those same medications and those same treatments are available to people who live in East Florence and who don't have any resources to pay for it. So there are ways that we're able to get access to those drug treatments for our patients, the same thing that Magic Johnson had.
Interesting.
And I love that. I love the fact that we're able to make a difference in people's lives. But back to Magic for a minute.
Okay.
He was my childhood hero. I remember that press conference like you do.
Yeah.
Ironically, the night that he made that announcement, that's when this support group started in Florence. These guys met in a living room here way before my time, and they formed this support group. And it was coincidental. I don't believe in coincidences, but it was happenstance that they happened to meet. They didn't know he was going to make that announcement to form the group Hope for the Pee Dee. It was a support group, very grassroots. They cooked meals. They provided transportation. They didn't have employees or money, but that's how it all started. The night Magic Johnson announced to the world he's HIV positive. So we had that as our founding date, 1991. I think it was November, I want to say 11th, 1991.
Okay.
And that's the founding date of Hope for the Pee Dee. We later changed our name. We rebranded and changed our name to Hope Health, became an FQHC in 2007, and really just opened our doors to healthcare for anybody in the community that needs it.
Wow.
So, I mean, we've seen that footprint expand. I mean, you've got a beautiful facility, and I can't remember which guest it was, but one of the guests we've had on the podcast was just, singing praises of you and the organization you lead, Hope Health, for being downtown Florence. I know you're also over on Southborough.
Yeah.
And so tell us about the broader services and who can go get service.
Yeah.
Or
basically anybody. And I think that I'm glad you asked that question, because there are people in our community that misunderstand Hope Health. There are actually some people that don't realize what we do to help the indigent and needy.
Yeah.
And then there are people who think that that's all we do is help the indigent and needy.
Right.
And so, the message we want to convey is all of the above, right? We have patients at Hope Health that are members of the country club and that own businesses, lawyers, doctors, et cetera. And they choose to come to Hope Health for their care because of the quality of services that we provide. And some folks like the idea that our resources go to help other people in need. So it's like giving back.
That's right.
That's cool. Yeah.
So what do you call that? What's that term?
Paying it forward.
Paying it forward. Yeah, there you go.
It forward.
But then when people are living at or below the poverty level, 200% of poverty or below, we have a sliding fee scale. So we're not a free clinic. We have a free clinic here in Florence. They do an awesome job. I don't know if you've ever had Mercy Medicine in, but they do some great work. That's not what we are. We're not a free clinic. But we charge on a sliding fee scale. So it's based on family size and income. So if you're 200% of poverty or below, we charge you based on that. And so the bottom of that scale, the nominal fee is $20. Wow. So for $20, the poorest of the poor can come in and see a physician or nurse practitioner. If they need x-rays or labs as part of that visit, it's covered by the $20.
Oh, my goodness.
And then if they need medications and they can't afford them, we have 3 or 4 different programs in place to help them get their medications either at a reduced cost or for free, depending on their unique situation. Again, their family size and income and any unique situation that they might have. So that's where we're different than a private practice, is the sliding fee scale and the ability to have programs that help people who can't access care in any other way. the payback for the taxpayer, for people in the community, is if you've got someone who, take a Medicaid patient, for example, Medicaid patient, our taxpayer dollars pay for folks to have Medicaid. Yep. I'm a big supporter of that program. I hope that people use it for a period of time in their life when they need it and then can eventually move off of it. But for as long as they're on Medicaid, you and I are paying for it.
Right.
If they go to the emergency room every time they have a sore throat.
Which is what was happening.
Yeah.
Yeah.
And it still happens.
Yeah, still
to the degree that we do our job as a community health center, we educate the community and we help those folks understand you don't need to go to the emergency room for non-emergencies.
Right.
The hospital doesn't want folks coming to the emergency room.
But they think that's their only option.
That's right.
Yeah.
If you grew up in a sort of a family situation or a culture where grandma went to the emergency room when she got sick, mom went to the emergency room when she got sick, that's all you know.
Yep.
And particularly if home remedies didn't work, you tried home remedies, they didn't work. So as a fairly qualified health center, and we use the term community health center just to simplify it, we want to educate the community that everybody can have a family doctor. Everybody can have a medical home. And we preach that to anybody that we come in contact with. And ironically, when we're doing our job, it's unique. The folks like we're talking about, the poorest of the poor, have engaged that message, and they're like, yeah, okay, I can have that. That's what I want. Somebody who understands my family history, who will go the extra mile to help me get the things that I need, who will pay attention to the resources that are available in the community that might help me. But what I'm finding is the upper middle class, upper middle class folks in our community that I talk to, they're like, well, I don't have a family doctor. And I'm like, why not? I mean, come on.
Yeah.
We're trying to convince people that everybody should have that. It should be part of your life. And even if you're healthy and you only need to get a checkup once a year, it's preventative health care. Mm-hmm. Your family physician, nurse practitioner can find things early on that might help you stay healthier longer. Absolutely. So that you don't go through a bad medical episode.
Right.
So Robert, if he's got Blue Cross Blue Shield, whatever insurance, he can go
absolutely
to Hope Health,
Yep.
visit a primary care physician, have that ongoing relationship.
Yep.
So
that's right. We would bill his Blue Cross Blue Shield insurance the same way any doctor's office would. Yeah. Perfect. We got Medicare, Medicaid, private insurance. In fact, Medicaid, Medicare, private insurance is 85% of our patients, and 15% or less is uninsured. So that surprises a lot of people.
That is.
Too. Yeah.
Yeah. And just briefly, I want to touch, is it difficult to get the message to the community that's in need of the most help? You know, is it hard to convince them? Is there anything that the broader community can be doing to let people know about the services available to Hope Health? Yeah.
I think the first part of your question connects back to that conversation we were having earlier about workforce.
Okay.
To the extent that we have people who are engaged, who come to work every day thinking about how to make a difference and impact in people's lives, that becomes easier, right? Because people know if you're faking it, and people know if you're going through the motions. They know when you're sincere. And so if our workforce, and we have 700 and some odd, close to 800 employees at Hope Health, if those folks are truly engaged in what they do, to the extent that they are, they're going to have those conversations, and it's going to be easier for people to trust them and for people to say, yeah, you know what, I do want to try that. I do want to keep my appointment. I do want to do a better job of showing up for my appointments when they're scheduled. And so the second part of your question is the community at large. And I think we feel like we're really good at marketing and advertising. And when we compare ourselves to other community health centers around the state, we would give ourselves an A, but it's not good enough, right? It's like because there's still people who don't know what we do and understand what we do. So I think, and rather than be offended by that or to be disappointed by that, we have to realize that's an everyday kind of task, right? to spread the word, to talk about it, to ask other people to talk about it. And the two of you know now, so you can
that's
tell
right.
your friends, you know,
Exactly.
right?
Yeah.
And so doing podcasts, doing commercials, doing billboards, things like this that help us continue to put that message out there of who we are and what we do.
Well, and I know the billboard I see most often is Lenore Sellers.
Yeah.
And him promoting, and you're a big, like we've already said, you're a big Gamecock, and y'all have done a lot with Lenore. And I was at the event at the country club where y'all had him in to speak and share a little bit about the mission of Hope Health as well. So you're definitely getting the word out.
Yeah.
And it's encouraging to see that.
Thank you.
You're the one that kept him at Carolina.
It was all me.
Okay,
It was
good.
me.
Thank
It was Hope Health.
That's right.
Not even close. Yeah, we have a great relationship with Lenore, and now Jaden, his brother, and they've just been terrific people.
Their heart's still in this community,
Yeah.
isn't it? It's cool. Like he still very much cares about this community.
Absolutely, and you can see it in what they do and how they talk, and people can't get all of what I wish they could get from the two of them, because they're both men of few words.
Yeah.
Like if you interview them, they're not interested in bloviating.
Right.
They just tell you, they answer your question and they move on.
Yeah.
And I think that's sort of kind of a tribute to how they were raised. They're not big talkers, right? But they're great guys. They have a great family.
They do.
Their mom and dad are both solid people, and I've enjoyed getting to know both of them. And I love the fact that we were able to have this deal. Lenore and Jaden both received services from Hope Health. I'm allowed to say that
That's awesome.
as part of our deal.
Yeah.
And so the fact that they were patients in our pediatric practice as they came along just made it very natural for us to say, hey, why don't we work on a deal together?
So from a broader Florence perspective, our podcast is trying to highlight positive things that are going on in Florence, as well as things that we can, as a broad community, can work to improve. Give us your perspective, having lived in Florence now for 20 plus years.
Yeah.
What are some ways?
What
What do we need to do better?
Wow.
Do we have 3 hours left?
Yeah. That question has somewhat of a double-edged sword. On the one hand, I moved here in 2000, so I brought my wife here kicking and screaming, not because anything negative about Florence, but she just lived her whole life in one place, Columbia, South Carolina.
Columbia was home. Yeah.
And that was home, and that's where her grandmother was, and that's where mama was, and she just like, do we have to go?
Yeah.
And I said, it is an opportunity, and she realized what the opportunity that I had here, and we got here, and this is my perspective. I don't know how many people would agree to this perspective or not, but when I came to Florence in 2000, my wife both and I felt that Florence was somewhat closed as a community. It felt closed to
I could
us.
see that.
Oh, yeah.
I could see that.
And it was like either you grew up here or you didn't.
Yeah.
And I think for the first maybe 5 years or so, it felt that way.
Yeah.
But gradually, that went away. And I think we started making friends, and we started to get to know people, and established our church, and it started feeling different. And some of that could have been Florence, and it could have been some of the folks that grew up here that kind of like, well, I prefer for it to stay like it was.
Yeah.
And some of it could have been us, just not.
You weren't ready to.
We weren't, weren't ready to go out and meet people and to give and to open ourselves up and that type of thing. And so it could have been a two-way street. But I do feel like that over the past 20 years, well, now it's been 26, that you've seen Florence just change so much, and it seems more open. There's a lot of people
that aren't from here.
The people that are from here are so good to talk to and so good to be around, and they care so deeply about their community. And so I think, as we begin to realize that and see that, that's made it easier. And then the stuff, right? And Beth and I talk about this sometimes. When we came to Florence, there were like 3 or 4 places to eat.
Yeah.
You know, I mean,
that was
Red Bone Alley was here when we came, and Percy and Willie's, and there was a place called PJs or something like that.
Yeah, PAs.
PAs.
With PAs.
PAs.
Back in the day.
Yeah.
There are a couple other places, right?
Yeah, that was about it.
Yeah. And then you just started seeing the growth and the development, and now there's a lot of places to eat.
Mm-hmm.
Still can't get anywhere on Friday night, but
Yeah.
you gotta wait.
Yeah.
But a lot of choices and a lot of growth and a lot of cool stuff to do, and I feel like opportunities for kids. The museum wasn't here when we moved here. The Florence Little Theater wasn't here. It was here, but it was out on Cashua. That's new. The library was built since we've been here.
True.
There's so much development and so many things that have happened, and we utilize all of those things. My daughter, Carl Elizabeth, she'll turn 9 this month, goes to the library all the time.
That's awesome.
And we take part in things at the Florence Little Theater, but we go to the museum. We were just at the museum a couple weeks ago, walking through the exhibits
awesome.
there. Yeah. So I see so much, and I don't know that I'm the right expert to talk about what else is needed. I served on downtown economic development, and I see some of the businesses that are coming downtown, and I'm glad about that, and it's exciting. But I don't know. I'm a little stumped over what we need because
I think there's a lot more growth to come too. I think
absolutely.
As we've got the population base growing, and we finally got Publix coming, and that's going to bring all kind of new things out that way.
So it's not a myth anymore.
No, it's not a myth.
Finally,
We talked about
see
Publix
it.
for what?
We see it.
At least
Since
10
you
years.
moved here.
Yeah. But I was having coffee with a guy this morning, and we were talking about the next 10, 15, 20 years. And I think some things that Florence Economic Development is doing to have shovel-ready sites for manufacturing. We've got a lot. Maybe we're overbuilding single-family homes right now, but that's going to give us opportunity for more manufacturing to bring in more jobs for these people to live. It's still a low cost of living respective to the state and country. So I'm with you. There's a lot to be excited about.
Sure.
With Florence.
There's some beautification things that need to happen.
Yeah.
Like your facility downtown, y'all landscape that, it looks great.
Yeah, thank you.
And that starts changing because that area looked horrible.
Yeah.
But we need the other businesses around there. If they could just step up the landscaping,
Sure.
and some beautification, it'd go a long way.
I agree with that. And I think, I don't know on a macro level how to make that happen, if it's city and county coming together, but businesses and everybody sort of coming together and chipping in to say, what can I do? How can we make a difference? And Hope Health wants to be a part of that for sure. I mean, we did put a lot of time and attention into that corner.
Yes.
And how quickly people forget, what it looked like. And so, I have to, always try to give credit where credit is due and recognition to the people who have helped us, because we did not transform that corner on our own. We had the city came in, and Mayor Wakila at the time approached me about, we had a federal grant that was going to allow us to build a addition onto our building over on Palmetto Street, the one next to KFC.
Oh, really?
It's going to be a 3-story addition onto the front of that building. Imagine that in your head, what that would look like. I don't think it would have been ugly, but it would have been weird.
Right there.
We would have had no parking.
Yeah.
At all, which was we were sweating it out because the feds funded us for that project. You had to already own the property to apply for the grant, and we were counting on some parking that it started to become obvious that we weren't going to get it. Some land related to some parking. So anyway, the mayor comes along and says, "What if we move that project over to the corner we're at Irby Street?"
Okay.
And I said, "All right, well, what does that look like?" And, they started talking about a donation of the land to us, and Dr. Bruce and Lee Foundation had put considerable amount of money into cleaning up that property.
Wow.
Y'all grew up here? Did y'all?
Yeah.
Was that where the plane?
You remember the airplane?
Yes.
And these old abandoned warehouses were there. It was a dump. We,
Yeah, it was
people
horrible.
called it a dump,
Yeah.
recycling dump. But
Yeah.
they had spent millions cleaning it up, and the city wanted to do something there, and there were lots of different thoughts about what they were going to do. Well, they landed on us, and we're grateful for that. They donated the money, and at that time, Hope Health was really on the rise. We were having great success. Our revenues were just multiplying every year, and so it allowed us to build that beautiful building. Phase 2, which was, if you're facing the building, the wing on the left, was going to be 5 years down the road. And before we could get phase 1 finished, we were outgrown and needed to build phase 2.
Wow.
And actually, if you look at the footprint of that building, you'll see that phase 2 on the left is twice as deep. Like, you can't tell from the front of the building, they look the same. But if you count the window panes, it goes one window pane more on the left, and then it's twice as deep. So that wing is probably 2 or 2.5 times the size that it was intended to be because of our rapid growth at that time,
Wow.
which I just, I feel like is blessing from God that he allowed us to have that growth and that it came at that time. But ultimately, that really allowed just this beautiful building.
Yes.
Landscaping was important to us from the very beginning because we said, hey, we owe it to the city and the county and the folks that live in this community to make this building not only build a nice building, but to have beautiful grounds. And we've continued to try to be committed to that. And that railroad that comes along
That's
the
right.
back
Yeah.
side,
Yeah.
that part came later, where we said that wasn't really our property, but we negotiated a deal to be able to get it so that we could clean it up.
Yes. It looks good.
And so it's just it's our contribution, but what else do we need to do, right? We want to continue to contribute and do our part to beautification.
That was visionary leadership at the city
Yes.
that helped put that in place
Yeah.
with the right, and we need more of that.
Yeah.
Yeah.
Well, but it's encouraging to hear that it's happened
Yeah.
and to see the fruit of it. And I think that leadership still exists.
Yeah.
It does.
Yeah.
It does.
Yeah.
And so
We've got some good folks. In fact, we're in conversations with the city about some more projects similar
okay.
to that.
Good.
And I won't get too much
Yeah.
into the details of that, but there's some
more to come,
thought
maybe.
around what we can do. Yeah, yeah,
Awesome.
absolutely.
Well-
In the meantime, let me just say this too. Kind of going back a little bit to Hope Health's impact, we have 22 sites across the state where people get health care. And so what we've done on Irby Street, and you mentioned our place out at Pine Needles, we've got the pediatric practice on Second Loop, we've got the specialty practice on Palmetto, but we're in Lake City, we're in Manning, we're in Kingstree, we're in Orangeburg, we're in Hemingway.
I didn't know that.
I didn't either.
We have 22 service sites
Wow.
where people receive care, and we're proud of all of that. We're here to talk about Florence, but I love what we've done in Manning. We've got a huge facility there. There were 2 buildings, and we connected them with like a third building to turn it into one large facility, and we're just doing really great
Yeah.
things in Manning, South Carolina, but in Kingstree too, and all over the place.
That's awesome. Manning, you don't think about, Manning is somewhat a part of our community too. There's a lot of
Yeah.
people from Manning that come to Florence
Yeah.
for healthcare needs and to shop
Yep.
and church. I've got
Yep.
people at my church from Manning.
Go to the movies, all types of things.
Yeah. So there's, when you start talking about Florence and the Pee Dee and then it's a pretty
Yeah.
big area that funnels back in
Yeah.
to Florence.
It's less than an hour to get to Manning.
Yeah.
It's like 45 minutes, depending on which side of Florence you live on. And people I don't know that it's technically considered the PD.
I don't think it is.
But it's maybe outside the PD
But
region.
McLeod's there now
Yeah.
too.
Yep.
So we've kind of grown into that
Yeah.
town.
Absolutely.
Yeah, it's interesting.
Before we let you go,
Yep.
I want to acknowledge and just congratulate you. You are the Boys and Girls Club's 2026 champion for youth.
That's awesome.
You coming to the dinner?
Yeah.
Yeah,
Yes,
I'll come in.
We're
Okay.
planning.
Yeah.
Planning
Yes.
to come.
All right, yeah.
And just congratulations. And
Yeah.
I think that award acknowledges the impact that you and the people who you lead every day have done for the boys and girls in our area. So well done.
Thank you for that, Reeves. I appreciate it. I'm humbled by it. If you look at the list of past recipients, it's like a wall of fame. And I'm like, man, I don't know if I belong on that list. A lot of great folks have received that award over the years. And so I was humbled by it and I'm honored by it. And I would say to anybody listening, there aren't many organizations that in the Pee Dee that I would promote over the Boys and Girls
Wow.
Club. And that's saying a lot because we
yeah.
partner with so many not-for-profits and we give to them and particularly the ones who we serve the same clientele. But the Boys and Girls Club, Neil Zimmerman does an excellent job out there, and they're making a real difference in the
Impact.
lives of young people. There are kids that go there that have parents like we had that were raised like I was raised and have good, strong male role models, fathers, and so forth. So I don't want to, purport that everybody out there didn't have a dad, right?
Right.
Strong families whose kids participate in the Boys and Girls Club, but there are also a lot of kids we know that didn't have that advantage.
Yes.
They didn't have some of the things that you and I grew
There's
up
a lot
with,
of
right?
them.
Yeah,
A lot.
right.
Yeah.
And they're there to fill that gap,
That's awesome.
right? And so I would say, please, if you're listening to this, support Boys and Girls Club. Write them a check. Give what
That's
you can give
good.
to them.
Well,
That's
yeah,
good.
that is encouraging. And that's something, Robert, you and I've talked about
Yeah.
with Till, and talking about the dynamics in her class and even some of the teachers that your daughters had and them kind of coming to you privately and saying, hey, can you help? This kid doesn't have this. This kid doesn't have
A
that.
lot of need out there.
So to know the Boys and Girls Club is doing that.
Yeah,
And-
absolutely.
And that's encouraging to hear.
I think
you
a lot
say
of
that.
people get a little jaded now because you're like, okay, I don't know which organization's actually making
Yeah.
the impact like they're supposed to.
Yeah.
But hearing you say the Boys and Girls Club is the real deal
Yeah.
goes a long way.
Yeah, absolutely.
And that's awesome.
Yeah.
Yeah, we thank you for all you do in the community.
Appreciate it, guys. I'm honored to serve.
Yeah. Well, thank you. Any way we can help you, let us know.
Okay, we'll do that. Yeah.
Thanks.